The AMSA injection is a very comfortable injection that's going to anesthetize multiple teeth. It has 3 different stages. The first stage is to pierce the tissue. The second stage is to penetrate through the palatal tissue to the palatal bone. And we're at the injection site of the palatal bone to deliver the anesthetic comfortably. So to start the injection, we find the bevel of the needle and we use a pre-puncture technique. We lay the bevel of the needle up against the tissue, and then with a cotton tip applicator, we put pressure on the back end of the needle and on the tissue. We then start the flow rate by hitting the foot pedal, holding it down until we hear the voice say cruise. When the voice says cruise, we take our foot off the foot pedal. Now we're on cruise control throughout that whole injection. So after about 10 seconds of pressure on the back end of the needle and the tissue, we then take away the cotton tip applicator, and with a finger rest, all I'm going to do to penetrate the tissue is to rotate the needle 1, 2, 3. It just barely pierces the tissue, possibly half a millimeter to a millimeter, and the patient doesn't feel that. Now, before we start to penetrate through the palatal tissue, we should let some anesthetic go into the tissue. So we just pause for 5 or 6 seconds. During that pause, I would rotate the needle so that the needle is going directly to the bone and the flow rate will be towards the premolars. So after about 5-6 seconds, then I slowly start to move the needle through the palatal tissue to the bone. It may take me 8 or 10 or 12 seconds to hit the bone. What we have is an anesthetic pathway. We know exactly how much anesthetic is coming out of that needle. It's 1 drop every 2 seconds. So if we move the needle through the tissue very slowly, through a pre-anesthetized tissue, the patient won't feel the penetration of the needle. So we just rotate the needle slowly, and penetrate slowly until we hit the bone. When we hit the bone, we're in the 3rd stage of the injection, which is the easiest stage because the instrument is doing all the work. All I'm doing is holding the needle in place and allowing the anesthetic to flow throughout that palatal area. You'll see ischemia. How much do we deliver? It depends on the drug that you're using and on the patient. If we're using lidocaine on an adult patient, I usually deliver a full cartridge of anesthetic. If we're using articaine, we would use no more than 1/2 of a cartridge of anesthetic. If we are working on a child, those dosages should be cut in half. So using lidocaine on a child patient, you should use no more than 1/2 of a cartridge. When you've delivered as much of the anesthetic as you need, you enter into aspiration by hitting the foot pedal, releasing it, and in the middle of aspiration, which is about 6 beeps, in the middle, after the 3rd beep, you take the needle directly out of the mouth and then hold it away from the patient or put it on the patient's bib. The injection duration is about 1.5 hours, approximately, usually more. And the onset of the anesthetic is usually within a minute or 2. You're going to anesthetize from the central incisor all the way through the mesiobuccal root of the first molar. All the palatal tissue is completely anesthetized. The buccal labial tissue is anesthetized from the 2nd premolar all the way through the central on that side of the injection. If you were to use this injection bilaterally, now you've anesthetized 10 teeth. And what's really interesting about this injection is, of course, the patient's lip and face is completely normal. You have not anesthetized their lip and face, but you have buccal and palatal anesthesia and labial anesthesia, and of course, pulpal anesthesia. So also with this injection and then a simple PSA injection behind the 2nd molar in infiltration, now with 2 injections, you've numbed the whole quadrant. Both the palatal and labial and pulpal tissue are anesthetized.